Have you ever wondered whether every medical test your doctor recommends after you turn 70 is still helping, or whether some might add stress, radiation, and procedures rather than protection? Many seniors accept every scan or blood draw because it feels safer to collect information. Yet research now shows several routine checkups give little benefit and can even cause harm through false alarms. Today we'll explore 5 screenings that experts say deserve a polite no thank you, so you can focus on healthier years instead of more waiting rooms. Grab a seat, a cup of tea, and let's learn how less testing can mean more peace. First, please remember this conversation is about empowerment, not fear. Your body, story, and priorities are unique, and you deserve healthcare that respects that individuality instead of pushing a factory line of tests built for younger age groups. Knowing when to step away from certain screens can free up money, time, and spirit for activities that truly support longevity, like balance classes, nourishing meals, brisk neighborhood walks, and heartfelt chats with friends. By the end of our journey, you'll hold practical questions to bring your clinician, ensuring decisions align with modern evidence and with the life you still dream of living for many vibrant tomorrows ahead. Because today's title promises 5 unnecessary examinations, this script will flow through 5 clearly marked sections, 1 for each test, to keep things organized and easy to follow. Before every item, you'll hear the name of the checkup, the age cutoff many experts recommend, and a quick snapshot of why continuing past that threshold can backfire. Afterward, we'll share a short, relatable story illustrating the hidden downsides, followed by actionable alternatives that preserve safety while honoring your personal priorities. Stay tuned until the conclusion to receive a neat summary and printable checklist for your next appointment. These tools will help conversations feel collaborative, not confrontational, with teams. Guidelines in the United States update frequently, but most reference groups like the U.S. Preventive Services Task Force, American Cancer Society, and major specialty colleges now agree blanket screening loses usefulness as age and other conditions accumulate. They weigh how many lives a test truly saves against its costs, complications, and psychological toll. We distilled those data-heavy reports into 5 simple stop signals so you don't need a medical degree or endless search sessions. Use them as starting points, always factoring in personal history and clinician judgment when crafting a plan tailored to you. Remember, care grows from partnership, evidence, and respect for goals. First on our list is the routine dual-energy X-ray absorptiometry, usually called the DEXA bone density scan, repeated every year or 2 in many older adults. When osteoporosis medication was first released, doctors tracked bone numbers closely, hoping quick feedback would fine-tune dosing. Decades later, studies reveal that once treatment stabilizes bone mass, frequent rescanning changes decisions less than 4% of the time while still delivering radiation, small, yet cumulative, and co-payments. Leading endocrinology societies now recommend spacing scans 5 years apart or stopping entirely for patients whose scores and fracture history stay steady. That shift alone saves seniors hours spent in chilly imaging suites. Martha, a 75-year-old golfer from Ohio, was scheduled for her 3rd scan in 18 months. Curious, she asked what new information the test might uncover since her medication and lifestyle had not changed. The technologist shrugged, admitting many repeats simply satisfy computer reminders. After discussing guidelines with her physician, Martha postponed the appointment, choosing instead to invest the copay in walking shoes. 1 year later, her bones remained stable, and she had logged hundreds of steps on the fairway. Her takeaway: sometimes you strengthen your skeleton more by moving than by measuring. She now shares that lesson with friends over coffee at the clubhouse. If your doctor suggests an early repeat DEXA, gently pose this question: will today's result lead to a change in medication dose, duration, or lifestyle prescription? If the answer sounds uncertain, propose delaying until the 5-year mark unless you suffer a new fracture or switch therapies. Meanwhile, focus on everyday bone builders, standing yoga poses, light resistance bands, calcium-rich greens, and checking your home, for loose rugs. These actions actively reduce fractures, whereas extra pictures mainly quantify the risk you already understand. Empowered with evidence, you can replace a yearly scan with habits that truly fortify you. Plus, you'll escape radiation and a morning fasting requirement. Now that we've tackled bones, let's shift to an area exclusive to men, the ever-controversial prostate screening blood work. Like Martha's repetitive scans, many gentlemen endure annual PSA draws without considering how age alters the calculus of benefit versus burden. Second on our stop list is the prostate-specific antigen, or PSA, test. Once heralded as a lifesaver, now recognized as a double-edged sword in men over 74. Elevated PSA can indicate cancer, but in older age groups, slow-growing tumors often remain harmless, while downstream procedures carry infection, bleeding, and incontinence risks. National Urology and Preventive Task Force guidelines therefore advise pausing routine PSA after 70 unless red flags emerge, such as rapidly worsening urinary symptoms. Before rolling up your sleeve, pause to consider whether the balance of harms and benefits still favors yet another vial. That reflection could spare you biopsies and anxious nights. Frank, 77-year-old Navy veteran, loyally visited the clinic each spring for his PSA. One year, a slight bump sent him down a cascade. Repeat test, ultrasound, finally a biopsy that left blood in his urine and dread in his thoughts. The result? Benign tissue. Frank realized the ordeal stole weeks of fishing, plus hundreds in gas and parking fees. With his doctor, he weighed life expectancy statistics showing minimal survival gain beyond 75 and chose watchful waiting. These days, Frank tracks only symptoms, not decimals, freeing his mornings for sunrise casting on the lake. He now educates veterans at the cafe about screening choices. If you're debating another PSA, start by asking how many men my age avoid death by doing this test, and how many endure complications. Your provider can reference statistics demonstrating false positives outnumber lethal cancers among seniors. Consider alternative monitoring, periodic digital exams, urinary symptom questionnaires, or tracking how often nighttime bathroom trips disrupt sleep. Each option respects comfort and autonomy over automatic lab draws. Should genuine warning signs appear, targeted imaging remains available. Declining routine PSA does not close doors. It merely ensures future intervention is necessary. You preserve dignity, reduce medical clutter, and still guard health with vigilance. As we leave the prostate clinic, let's walk to gastroenterology, where colonoscopy reminders pop up like persistent elevator music. Many of you endured prep, sedation, and recovery multiple times already. But if you turn 75 with previous normal scopes, evidence suggests the scales tip away from benefit toward potential harm. Perforation, bleeding, sedation, confusion. Third on the agenda is the repeat colonoscopy after a string of negative results. Colon cancer screening saves lives in middle age, yet data show another scope past 75 in someone with a clean history prevents few deaths while raising complication rates. The bowel prep can dehydrate seniors, and anesthesia occasionally triggers short-term memory fog. The American College of Physicians now recommends discontinuing routine scopes when earlier exams were clear and life expectancy is under 10 years. That guidance honors quality over quantity, acknowledging every procedure incurs opportunity costs. Skipping allows energy to be invested in fiber-rich meals that truly aid digestion. Dolores, a 78-year-old quilter from Arizona, received an auto-generated appointment letter for another colonoscopy. She hesitated because her cardiologist recently increased heart medications, making sedation riskier. During a pre-procedure phone call, she asked, "Will this scope genuinely improve my future?" The nurse consulted guidelines and agreed odds of benefit were tiny given Dolores' spotless record. Appointment canceled. Dolores spent the scheduled day piecing a sunflower quilt for her first great-grandchild. She later joked that the only tube she threaded that week served her sewing machine, not a hospital monitor. Dolores' story reminds us reclaim time blossoms into family memories. If your reminder card arrives, pull your previous pathology reports and ask, was my last colonoscopy truly negative, and were any polyps removed? If yes, and you are beyond 75, presenting guidelines supporting discontinuation can shorten dialogue. For ongoing surveillance, fecal immunochemical tests mailed to your home detect blood with no sedation and near-zero procedural risk. Pair that option with daily produce, adequate hydration, and regular walking, which speed colon transit and reduce cancer risk naturally. You trade a grueling prep day for gentle, sustainable prevention. Your digestive tract will thank you, and your calendar regains breathing space. With the colon contentedly addressed, we turn to cervical screening, a surprise because many women assume Pap smears continue indefinitely. Research shows that after 65, provided 3 consecutive negative tests and no history of high-grade lesions, future smears add negligible benefit. Fourth on our list is the cervical Pap and HPV co-test. In younger women, these screens catch precancerous changes early, but in seniors with decades of negative slides, cervical cancer becomes exceedingly rare. Continuing tests after 65 often yields faint abnormalities requiring colposcopy, which can be painful and frightening, yet usually reveals nothing worrisome. The American Cancer Society, American College of Obstetricians and Gynecologists, and U.S. Preventive Services Task Force all advise stopping screening when criteria are met. Doing so reduces clinic visits and lets you reclaim privacy and peace. Helen, 72, and recently retired from teaching, scheduled her pelvic out of habit. A friend mentioned research about stopping, so Helen asked her gynecologist to review her chart. 3 successive negative Pap smears, no prior dysplasia, and no new partners. She qualified to graduate. Helen canceled the appointment, traded the copay for a soothing spa pedicure, and later told her book club she felt 10 pounds lighter emotionally. Instead of paper gowns, she now spends Tuesday mornings tutoring neighborhood kids, proof that freedom from unnecessary tests can open doors to gratifying service. Her doctor applauded the decision, praising Helen for balanced stewardship. When your reminder postcard arrives, flip it over and write 3 consecutive negatives, age over 65, guidelines allow exit. Bring it to your appointment and simply ask whether your history meets the criteria. If it does, request documentation in your record stating no further cervical screening is indicated. That note stops automated letters and insurance billing codes. For continued gynecologic comfort, prioritize vaginal moisturizers, pelvic floor exercises, and attention to any new symptoms. Skipping the speculum does not skip self-awareness. It merely spares anxiety and frees time for watercolor classes, gardening, or cherished phone calls. We've covered 4 tests backed by science. Now, let's tackle a flashy newcomer. Whole-body CT scans marketed directly to consumers. Billboards promise peace of mind within minutes. Yet experts warn they often deliver radiation and a parade of incidental findings. Fifth and final on our chart, whole-body CT or executive scans sold as full-service checkups. These scans image head to pelvis in minutes, exposing you to radiation hundreds of times stronger than a standard chest X-ray. They detect tiny cysts, scars, and calcifications that rarely require treatment, yet often trigger invasive tests or surgery. Multiple radiology organizations caution against routine use, stating no evidence of improved survival. Despite that, slick marketing equates comprehensive pictures with ultimate safety, leaning on fear to sell packages. George, 71, and an avid cyclist, saw a freeway billboard boasting quick results and signed up. The scan found 3 millimeter-sized lung nodules. Panic set in. Over 8 months, he underwent repeated CTs for monitoring, each adding radiation and bills. None changed, and specialists finally declared them benign, calling the ordeal overdiagnosis. George calculated the total cost equaled a new carbon fiber bicycle. Realizing misdirected fear had hijacked his passion, He vowed to stick with evidence-based screenings and long Saturday rides instead. He now mentors other seniors at his cycling club, reminding them prevention also means protecting mindsets and budgets from unnecessary tests. If a clinic advertises a bargain scan, request written data on mortality reduction and radiation exposure. Chances are they can't provide convincing numbers. Instead, work with your primary physician to target real risks. For smokers, a low-dose lung CT within guidelines. For cardiac health, traditional cholesterol management and exercise prescriptions. Personalized prevention delivers far more benefit than scanning every inch without purpose. Keep your money for adventures that strengthen heart and spirit, not for images that simply catalog benign quirks. Congratulations, by reaching this point, you've learned 5 evidence-backed ways to trim low-value tests and reclaim time for pursuits that nourish body, mind, and community. Perhaps one item resonated more than others. Jot it down and commit to discussing it at your next appointment. Begin your empowered planning with a simple sheet of paper. Draw 3 columns: tests to keep, tests to pause, questions to ask. Fill the first column with screenings that still offer clear benefit for your profile. In the second, list today's 5 candidates for retirement. In the third, record the clarifying questions presented throughout this video. Bringing this sheet to your appointment turns a potentially awkward refusal into a structured, cooperative conversation between equals. Consider enlisting a healthcare buddy, a family member, neighbor, or friend who attends appointments virtually or in person. Research shows seniors partnered with an advocate recall instructions more accurately, feel less rushed, and experience higher satisfaction. Your buddy can help verbalize concerns, confirm action steps, and offer emotional support if discussions grow technical. Together, you form a united front committed to evidence-based, personalized care. Next, craft a personalized screening calendar. Use a wall planner, smartphone app, or index cards pinned near your coffee maker. Mark in bright ink the few tests that remain worthwhile, spacing them according to guideline intervals. Then deliberately block off leisure activities, gardening mornings, Tai Chi classes, or grandchild story hour on the same calendar. A balanced schedule becomes a visual affirmation of priorities and a daily reminder of why selective screening matters. Practice phrases such as, "I appreciate the recommendation, yet current evidence suggests this test no longer benefits my situation. Can we revisit it if circumstances change?" Delivering that line with calm eye contact communicates respect and conviction. Most clinicians welcome informed patients and may even feel relieved to avoid low-value care once you broach the topic. In summary, we reviewed routine DEXA scans, PSA tests, follow-up colonoscopies, pap smears after 65, and commercial whole-body CT scans. Examples where less can truly be more. You heard stories of Martha, Frank, Dolores, Helen, and George, ordinary Americans who gained freedom by asking thoughtful questions. You learned practical tools: the 3-column sheet, healthcare buddy, assertive language, and a bright calendar. Thank you for choosing this channel as your partner in senior wellness. If today's guide helped you rethink testing, please tap the like button, share the link with friends who might breathe easier, and subscribe so you never miss future discussions designed for older adults in the world. Ring the notification bell and join our growing community committed to health, curiosity, and compassionate living. Until our next conversation, stay active, stay informed, and above all, stay wonderfully you.